So I'm Dr. Sharp. It's nice to meet y'all. I am with the pain management department here at EmergeOrtho. I am a board-certified physical medicine and rehabilitation specialist with subspecialty training in interventional spine and musculoskeletal medicine. If you struggle with back pain, there are multiple treatment options available to you that we can hopefully utilize to improve your daily function and quality of life. So that's what I'll be talking to you about today, is in regards to back pain. The successful treatment of back pain largely centers on determining the exact cause of what's causing your pain. Back pain is often multifactorial, meaning that it has multiple different contributors, such as degenerative disc disease. As we all age, our spines have wear and tear just as we go through life, and we can get degenerative discs, which are the shock absorbers of the spine. When those discs degenerate, that leads to other downstream effects, such as pinched nerves or arthritis, stress in the bone, etc. There are numerous causes of low back pain. Other causes of back pain can be from peripheral joints, such as your hip joints from arthritis of the hip, or from the sacroiliac joint, which is a joint in your pelvis, low back region. Determining the exact cause of your low back pain ultimately comes down to close attention to the symptoms you're experiencing, but also correlating your symptoms with the MRI findings, finding what matches in your scenario. To name a few treatments for back pain, there are multiple different options, including epidural steroid injections to target inflamed or irritated nerves. There are joint injections to treat arthritic pain. There are ablation type procedures used to treat arthritis or stress from within the bone. Another option is an ablation procedure to treat arthritic pain or stress from within the bones of the spine. An ablation is a fancy way of saying that it's a needle-guided type procedure where the needle tip heats up and it treats the targeted nerves within the spine. This is generally a very well-tolerated procedure. Some procedures are even done under complete sedation within surgical centers. It just depends on the exact treatment. Finally, another more advanced option is what is called a spinal cord stimulator. This could be thought of as like a pain pacemaker, such as like a pacemaker for the heart. These can be used to treat back pain, leg pain, etc. If you have a flare of your typical low back pain at home, one of the best immediate treatments is to rest and avoid any exacerbating positions or movements that make your pain worse. You really have to listen to your body. It's trying to communicate with you. Other good treatments at home for a flare of your back pain symptoms would be anti-inflammatories such as ibuprofen or naproxen, if cleared by your primary practice provider. Steroids can also be beneficial as prescribed through a provider. I would recommend seeking out treatment with a pain specialist sooner than later, as research has shown that earlier treatment can improve your quality of life and outcomes. The sooner we can address your pain, the more likely you're going to do better. You should immediately seek emergency medical care evaluation if you experience severe low back pain that is accompanied by any of the following: loss of groin sensation, progressive weakness in your extremities, fever, unexplained weight loss, or loss of bowel and bladder control. If you feel that your pain limits your quality of life or how much you can do on a daily basis, I would be very happy to evaluate you and determine what options might be available to treat your symptoms. I am located in the Lenore office primarily, though I can also be found in Morganton and Hickory offices.